Well, we have a really packed agenda, and we're most excited to hear from all of you. So we'll go ahead and just jump right into it. Good afternoon, or whatever time it is for you locally. We are so excited to welcome you back for one final time in 2024 to celebrate your accomplishments, milestones, and all that you've achieved, as well as your goals for moving forward. We can't wait to hear from all of your state teams today, so let's not waste any time. Next slide. Just briefly, we'll look at the agenda. So we intend to proceed through states in alphabetical order, except where noted. We know that some states have some time constraints today. We will have a short closing where we will provide you with some additional information and resources you'll be able to use as you move forward with your efforts to provide comprehensive whole person care through your authorities. So everyone, please keep your cameras on and also be sure to rename your Zoom square to have your name and your state. And we encourage you to actively participate in the chat throughout today's meeting. Next slide, please. So every state received a 3-slide template with instructions on what each of you will be sharing with all of us, but more importantly, with one another. We encourage you to take this time to connect with other states who we hope you will continue to engage with in peer-to-peer problem solving and learning. Each state will have your chosen presenters walk through your accomplishments from 2024, lessons learned through the Accelerator, the challenges you have worked through and you continue to work on. And finally, we've asked you to share your state's top 3 goals for continuing to strengthen and expand cross-sector partnerships as you continue to scale this work throughout your state. Please note that each state will be given exactly 10 minutes, and we will notify you when you have 2 minutes left and when your time has ended. This will ensure that every state has a chance to share. Thanks. And next slide. So before we hop into the presentations, we did want to take a step back to hear from each of you. So on the screen, you'll see a QR code that will pop up here again. That will send you to a word cloud. So we wanted to ask you to put a word or a short phrase that has described your experience in the 2024 Housing and Services Partnership Accelerator. So we'll give you a minute or so to share. So you can either use the QR code on your phone or also go to slido.com and enter the code there, which is 1144578. And if everything works as it should, we can see in real time your responses. So we have connections, empowering, energizing, validating. Okay, energizing, getting bigger. We got a lot of folks who have felt that the experience has been energizing and validating, right? Each of you are really working on hard problems with a lot of pain points. And I see in the chat, Anna's put re-energized. So I love to hear that, to get re-excited and invigorated around the work that you're doing. Connections, collaborative. I think that's, I've seen the collaboration in real person and digital engagement too. Informative, helpful. And also feel free to drop comments in the chat and we'll just give it, see a couple people typing. Well, thanks everyone for kind of sharing your thoughts. And I see, a common theme around that collaboration and connection, which I think was a key goal of us launching this accelerator this year, to not only help really facilitate that cross-sector partnership at the state and local level, but also at the federal level. So we're excited to see and hear that that has resonated with each of your teams. So let's hop into our slides again, and we want to do a couple quick snap polls, and then we'll get into our presentation. So we have 2 polls. And the first one that we're having it pop up here is, what is one particular success that you attribute to the accelerator? And the second question that we have as a part of the poll is, what is the number one challenge your state will be looking to solve in 2025? So what is your top priority going into 2025? And we'll just give you all a minute or so to type in your answers. And our panelists can't vote in the poll. So if you want, panelists, if you guys want to drop your responses in the chat, feel free to do that. Yeah, John, I think you can't submit because you're set up as a panelist. But if you want to drop it into the chat with everyone to see it, that's going to be the best way. So we can go ahead and close the poll. And our co-hosts and panelists can just drop your responses in the chat. Okay. Do you want to pull up the poll results? Juliana, I don't see the, there we go. Perfect. Here we go. So we have increased knowledge, collaboration, communication across state programs, development of draft permanent supportive housing framework from North Carolina, integrated planning process for ACES expansion from Maryland, helping us to build relationships across state agencies from California. And then if we can scroll down to the second question, we have new administration at the state level and implementation, and then billing and continued coordination for Maryland, and keeping up momentum with monthly convenings within California. And then in the chat, we have statewide standardization of PSH definition, and our state's first PSH strategy for LIHTC. So really exciting priorities going into 2025. And let's pull the slides back up. And now, without further ado, we're going to go into our presentations. So first, we're going to welcome the Arizona team. So next slide, please, to present their accomplishments, challenges, and goals. From Arizona, we'd like to welcome Elizabeth DaCosta. Elizabeth, the floor is yours.
Thank you so much. And I appreciate how everyone was saying that they felt energized and validated, because I think when we look back like several months ago, that's exactly the experience that we had that helped us get to this first bullet on the screen, which is we went live with our Housing and Health Opportunities Program, H2O, on October 1 of 2024. And that's the Arizona implementation of our 1115 waiver to be able to actually pay for health-related social needs for our members. And I remember when we were first applying for HSPA, it was like nerve-wracking with all of the things we were planning on implementing, but absolutely we felt validated and energized. And so it took us through to the finish line to go live. The other thing that we did was we selected an H2O program administrator. So we decided to kind of follow what some other states were doing around not using your managed care organizations, but instead using a third-party administrator to administer the health-related social needs benefits. We learned a lot from other states through HSPA and selected our vendor in July of 2024. So then they were able to work over the 3 months before go live to really work quickly to operationalize everything for our H2O go live. The other thing is we were able to look at H2O eligibility and identify where our highest number of members are currently living throughout our state, and then go and outreach those leaders within those public housing authorities and invite them to be core team members. So that was really instrumental in some of the work we've been able to do today with our partnerships with City of Phoenix and City of Tucson. They actually came out to DC with us and got to see like the brainstorming that was occurring at the federal level that I think also energized them to really help support our partnerships. We've deepened our relationships with our federal partners at HUD. So I'm with our state Medicaid agency, but have always worked in housing. We have a housing department within our Medicaid agency, but we didn't have a lot of good connections with our HUD federal representatives. And so now we're all on a first name basis. We actually were on site at one of the grand openings for one of the LIHTC properties we supported this morning, and a few of them were there. So it's nice to be on a first name basis with them as we work to kind of navigate some of the goals that we'll get into next. We finalized our data share agreements with all 3 continuum of cares within Arizona. So learned a lot about data share ideas, through HSPA. And we have 3 continuum of cares. At the time, we really only had a data share agreement with Maricopa County, but we've now finalized it with our balance of state and then also Pima County. So currently, right now, Access receives, the state Medicaid agency receives the members who are active on the community's by name list in the homeless management information system. We get all that data, and then those members are included as potential eligible members for H2O eligibility. So they may be missing Z codes within the Medicaid system, but we're still capturing them because they're showing up on those HMIS reports. We had a lot of learning to do with our AAAs and our community care hubs. And so I think we had to focus a lot of efforts on H2O implementation. But one of the things we've done in partnership with our AAAs is kind of closed out all of the goals related to H2O implementation. And now we've got a separate pilot program going on where the City of Phoenix has dedicated housing choice vouchers for members that the AAAs have identified as being in need of those subsidies. And we're working on this pilot program where they'll be able to refer those members in. And then in turn, City of Phoenix is looking at expedited ways in which they can help members get access to AAA services or also our long-term care services. We can go next slide. Some of the challenges that we experienced. And so I think, when we looked at, okay, where are our highest populations of members experiencing homelessness and found that most of them were in City of Phoenix and City of Tucson, we thought, we need to implement, we're going to be implementing 6 months of short-term rental assistance. So our program is dependent upon these partnerships with public housing authorities who have those long-term federal subsidies. And so when we went to go talk to them about, hey, do you think you can have some vouchers that can come kick in month 7, right? We noticed that they were already fully spent with their budgets. And so what we found within Arizona is that we're pretty under-resourced. Some of our fastest growing cities that have same population size compared to other cities across the country receive a substantially lower amount of housing choice vouchers. Another challenge we identified was that, when you're thinking about, okay, well, Medicaid members live all throughout the state and they may be eligible for these short-term rental assistance dollars, we would really need to establish partnerships with all public housing authorities across the state so members would be able to lease up in the communities in which they're currently living or where they want to live. And so we really need to have partnerships with all of our public housing authorities. And so just understanding how many there are and how many different contacts we would need to make in order to help try to standardize any processes was a bit of a challenge. Another thing is the need to align our referral and application processes with our public housing authorities, because we at Access have a statewide housing administrator who we have used, who helps us administer our state rental assistance program. And they're already doing things like verifying tenant income, determining the housing assistance payment, verifying that the housing meets HQS requirements or coming on Inspire requirements. And so we really want a system where we don't need to have the PHA do that duplicative work again. And so a lot of efforts need to take place for us to work together on standardizing the process and then having one process that all of us can follow. Additional challenges around data sharing. Obviously, a lot of folks know about that, but just sharing of Part 2 data, what can the Medicaid system put in the homeless management information system? So just a lot of the challenges that we've discussed so far. We can go next slide. And then this one kind of is a bit of you'll hear some repetitive stuff, but I think it's important. But we have lessons learned. We have developed those HUD contacts and partnerships. And then as a part of our sustainability plan, taking the time we're no longer spending on HSPA, we've scheduled roundtable discussions within Arizona where our leaders of our public housing authorities will participate. Our HUD regional contacts will be there, and then Medicaid will be there so that we can all continue to work on understanding the nuances of how we're going to, move someone from 6 months short-term rental assistance under Medicaid over to their federal subsidy, and which includes standardizing those processes and having the PHAs maybe accept our statewide housing administrators' work rather than duplicating it and doing it again. Another lesson learned was, the need to really understand the public housing authorities' administrative plans and whether or not they have homeless preferences within there. But those are definitely key takeaways that we learned. And then we're building out a toolkit to help PHAs be able to have the language that they can add into their administrative plan, should the language not currently be in there. We learned a lot around our AAA resources and their priority populations, as I mentioned. Something that was really important to access Medicaid was our payment reimbursement methodologies for our 1115 waiver services. We really wanted to engage community-based organizations to have a process where they could actually bill Medicaid without having, the electronic health record that is required. And so we learned a lot through HSPA on, just basically how we could develop invoice processes for community-based organizations and then build a requirement into our H2O program administrator for them to turn those invoices into HCPC codes. And so all that is actually already fully developed, and our H2O program administrator has an entire solution where CBOs are sending in invoices and they're turning it into HCPC codes for us today. Learned a lot of lessons around data sharing and use cases. So one example is, like I shared, receiving HMIS data to help inform concern for homelessness for our members and use that to help determine potential eligibility. Another, though, is even for members who are not eligible for H2O services, receiving that HMIS data and then identifying who the member's health plan is, and then sharing that information with the health plan so that they can implement their care coordination requirements to help use other resources within Medicaid to help members address housing insecurities. And then lastly is the vital need for resource integration, which gets us to this last slide, and I'm wrapping up. But what this image tries to show is this vital need for resource integration. Go next slide. There we go. So when we received our approval for our 1115 waiver, we wanted to make sure we didn't come in as like another silo on the housing highway, but actually work to create new on and off ramps for services to help make sure we're fully integrated. And so like I mentioned, our solution and goals moving forward is we've got those roundtable discussions scheduled with our public housing authorities. So those are all set up. So we'll continue on with the conversations. We're continuing to do this pilot project with City of Phoenix and City of Tucson. We're going to monitor the results of our rate methodology for our per member per month rates that we did, so we can figure out what parts of those we can actually transition over to requirements that our managed care organizations implement. And then looking at also ways to create standard operating procedures. So if a member is receiving continuum of care permanent supportive housing services, we have a common definition for our expectations for our Medicaid permanent supportive housing services. And then just continue to evaluate and monitor our impact so that we can hopefully grow the program and continue to provide the service for additional populations for years to come. Thank you.
Thanks so much, Liz. And that was a really great way to kick us off strong and a perfect 10 minutes. So now please welcome California, led by Anna Acton. And next slide. Yep, let's get into it. Anna?
Thank you, Ryan. Great to be here. So we're going to go over our slides. Just to start with a look back for California, we really work to deepen that engagement and alignment between state and local partners across health, managed care plans, social services, and housing sectors. And we talk social services really also leaning into those disability and aging networks. We solicited and received really good, actually, input, meaningful input on key policy design issues for our CalAIM managed care transitional rent. So we're still waiting on CMS approval there, but we got really robust feedback leveraging a few different stakeholder groups. And we're just continuing to march ahead, assessing our waiver strategies around housing, community supports, and working towards implementation. We developed a plan to leverage HUD mainstream vouchers and create awareness amongst Medi-Cal managed care plans, our CalAIM plans, social service agencies, aging and disability networks, and HUD public housing authorities. And I think there's just really an opportunity to better leverage and engage across, right, the healthcare, housing, and disability and aging networks to coordinate both the short-term rental assistance with long-term support, and then leveraging those health and human services, disability and aging networks to really help with not only identifying people for housing, but also to help with those ongoing supports that will help them stay stable in their housing. We identified models that integrate our health-related social need benefits within permanent supportive housing projects. So we have 6 housing-related services here in California, and really looking at coordination. We looked at coordination between housing developers and CalAIM, community supportive housing services, to really improve that housing stability for our target population. We'll go on to the next slide. We have more, we're going to go into lessons learned here. And so we really learned from the field, from the local level. Oh, sorry, I skipped ahead for you there. So yeah. So looking at lessons learned, we really learned from our local field, from providers on different strategies that can be taken with transition rent and how services can be utilized amongst providers. So some of the things that we really looked at here was increasing our standardization across health-related social need services for more consistency in delivery of the housing services in local areas. I remember California is a large state with many counties, and really trying to get some standardization across the services. So this also includes like how to standardize our referrals, right? Referrals not only from health plans to the community supports and contractors, subcontractors, but also from community providers to the health plan. So that bi-directional referral, standardizing that process across the state is really something that is needed and we're looking at. Also, really braiding funding sources is in an optimal way to optimize various sources of funding. So we really looked and need to continue looking at how to braid funding between HUD, our public housing authorities, right, our voucher programs of subsidized housing units, Medicaid and CalAIM, our aging and disability networks, and other social service providers, including behavioral health. One of the things that we're looking at from these lessons learned is looking at flexible housing subsidy pools or flex pools. And that's something we're actually going to be continuing to work on beginning in January. So challenges. So looking at some of the challenges, we really challenges include identify linking individuals to longer term subsidies, right? And with permanency, once the transition rent, that 6 months of transitional Medicaid, CalAIM rent ends, how to connect them with that ongoing subsidized affordable housing. In California, we have 24 managed care health plans. We have 44 continuums of care, over 100 public housing authorities. So that really creates that challenge in really having to depend, right, and lean into and support the local level efforts to braid together and administer these various funding sources that often are very siloed. So really need to look at that breaking those silos across the partners and the different funding and support systems. We also are incorporating, challenges include incorporating health resources into existing housing systems and really recognizing that requires a deep focus on stakeholder engagement and identifying best practices. And having to leverage that local leadership again, with being so vast and how many different partners we have in California, we really need to leverage that local leadership on these issues. And that will be a challenge. So the next slide. So on sustainability, so we are maintaining our partnership ongoing at the state and local levels between health and human services and housing partners. We'll also be engaging learning forums. We'll be actually, doing learning forums, webinars, trainings, to help with integration of Medi-Cal resources, such as the transitional rent, into development projects for permanent supportive housing. And we'll continue to engage and collaborate between housing providers, counties, and managed care plans. One of the things we have here in California is our California Interagency Council on Homelessness. So this is really a cross-department state effort to coordinate homeless and housing services in California. And we are just approved our new California Interagency Council on Homelessness Action Plan that has multiple goals and initiatives in it that basically came out of the HSPA work, where it will continue the efforts that we started here moving forward on these very issues that we just touched on, to build off of the lessons learned, address some of the challenges, and keep this work sustainable. And really, as an example, some of those action plan items are around that cross coordination, educating our continuums of care, and the disability and aging networks and the public housing authorities on each other's programs, helping to bring them together to braid and coordinate services across the system. So I think that's it. Thank you.
Thanks so much, Anna and the California team. Now we'll next slide move on to our team from Hawaii. The floor is
Aloha,
yours.
everyone. Oh, thank you. Thank you, Ryan. Aloha, everyone. So my name is Alana Souza, and I am a co-lead of our Community Integration Services program, CIS, which is the Hawaii MedQuest Homeless Services Program. So we're very happy to be here today. Thank you. And we're excited to share what we're able to achieve over the past year. One common theme that you will find in our accomplishments are the development and strengthening of relationships. This is called Pilina in Hawaiian, which means having strong connections within the community. So one example of Pilina for us in relationship building is with our continued collaboration with we only have two Continuum of Care in Hawaii, partners in care for Oahu and bridging the gap for the counties of Kauai, Maui, and Hawaii Island. They developed a mapping for housing resources and housing funding infrastructure. They guided us through their coordinated entry systems and helped us to identify a housing pathway for Medicaid members, which will help us when we implement our anticipated upcoming programs of medical respite and rental assistance once we get approved in our 1115 waiver renewal. We also created opportunities for development of those relationships by opening up our weekly Monday, Wednesday, Friday, 10 o'clock team meetings to other community stakeholders. This became a routine meeting and a place where interested parties could join us to collaborate. One example of a successful relationship that came out of that was our engagement with the Honolulu Mayor's Office Department of Community Services. We have since been invited and have been attending their monthly planning meetings to collaborate and stay informed of the initiatives that they are working on. We also completed community outreach and engagement with community stakeholders to help grow our relationships. We visited medical respite sites on Oahu and Maui. We completed site visits to Kauhale, and Kauhale means a tiny, like group of tiny homes on Oahu and Maui. We attended a medical respite hui. So hui for us means group or meetings on Oahu, on Maui. Sorry, we attended a medical respite hui meeting on Oahu, on Maui. Sorry, and participated in ongoing community engagement in preparation for our 1115 approval that's upcoming. And then another example of a strong community connection or a Pilina we have is with the Hawaii Housing Finance and Development Corporation. We are exploring applying for the HUD 811 program, which provides funding to develop and subsidize rental housing for persons with disabilities. And then to build relationships, we shared our experiences by providing presentations on CIS at the HSPA in-person meeting in June, at the Home and Community-Based Services Conference in August, and at the HSPA Learning Track in September. Next slide, please. So we have gained a tremendous amount of insight about housing over the past year. And here are some lessons learned and challenges that we faced. We realized that Hawaii's housing crisis is at an all-time high. Hawaii has a severe lack of affordable housing, and many families have become homeless and even left the state in search of more economical options. And this puts housing at the top of everyone's list. And through the work that we've been doing, we learned that partnerships, right, those strong community connections, Pilina, is key to this work. So continuing to collaborate with key community stakeholders who can influence resource allocation and also leverage resources is important. And attending the HSPA in-person meeting in June was an invaluable experience for the Hawaii HSPA team. We found that a coordinated statewide plan incorporating efforts across all sectors is needed. With housing being at the top of everyone's list, there are many initiatives being rolled out by different entities to address housing. And coordination of all of these initiatives to just one state plan would be helpful to allocate resources more efficiently. And we understand the importance of making evidence-driven decisions. Our current CIS program is the product of a reboot that we started in 2023 after receiving data from one of our rapid cycle assessments that was completed by the University of Hawaii, and also getting feedback from our homeless services community. And from our experience with the CIS reboot and HSPA, we appreciate the value of having flexibility and agility in program implementation. This HSPA experience has provided our team with broader insight that we'll be able to reflect upon when we're writing policies for anticipated upcoming programs. Next slide, please. So moving forward in 2025, we will continue our relationship building, our Pilina with Hawaii Housing Finance and Development Corporation to submit a HUD 811 application for funding. We will also apply HSPA learning accomplishments and partnerships. So again, those relationships to the implementation of our expanded 1115 waiver initiatives of medical respite and rental assistance. And finally, we will work to expand the capacity of homeless provider services networks on all islands, but especially outside the main populated islands in the counties of Kauai, Maui, and Hawaii Island. So we just like to say a big mahalo to our wonderful coaches, Lisa Sloan and Kathy Moses, and to all of our community partners that we've made connections with during this past year. Mahalo.
Great. Thank you so much, Hawaii. Incredible work. Now we'll move on to Maryland. So let's go to the next slide. And I think we have Sonia Ram. Is that correct for our presenter?
Hello, Ryan. So I think Daniel Maestro from our Maryland team will be presenting. And
Okay,
I can
perfect.
support if needed.
Tanya, feel free to jump in if I miss anything.
Absolutely.
Yeah, so we've had a lot of success over the last year. The first part of that is specific to our Medicaid waiver for housing related service, which we call ACES. It provides housing-based case management services for folks that are homeless or are exiting institutional settings and have chronic health conditions. So we have been working over the last year and using all the learnings from this collaborative as well as our touch points with other states and learning more about their models. And we are successfully transitioning, we're right in the middle of it, over to claims-based billing from our invoicing process that we currently have now. And we also submitted an expansion request to CMS that's currently under consideration. So fingers crossed, we're hoping to hear back about that soon. And if that's approved, that would more than double the current size of our pilot program to put it over 2,100 people that could be served. In addition to the Medicaid side, we also, well, I think we presented a prior webinar about this, but for the first time, the state incorporated a homeless requirement into our proposed LIHTC strategy for low-income housing tax credits. DHCD, where I work, had never incorporated homelessness into its affordable housing financing. So we're in the final stages of that plan process now. We just finished our public hearings and public comment. So originally we proposed a pretty bold change going from 0% to 15% of affordable housing units having a homeless preference or permanent supportive housing. And I think the final version might look a little bit different, but we will still have at least a pretty big chunk of those units going towards a homeless priority. So we're really excited about that. And we think that this is really laying the groundwork for even greater investment in future years. And then the other piece, we didn't specifically get TA on this, but we, through this partnership and collaboration, we developed really great partnerships, even deeper than we had before with our fellow sister agencies in aging and disabilities and health. And one of the results of that was that we collaboratively applied for the HUD Older Adult Home Modification Program and won a $1.25 million grant and also secured some private funding. And we will be launching this program in rural parts of the state. And it will provide low cost, high impact home modifications to older adults who are low income and are both renters and homeowners. And this will be the first time in our state that we'll have home modification services for renters. So that's a big gap in our system. And part of that process is looking forward, going to be figuring out how can we leverage Medicaid and Medicare to maybe help create a sustainable funding model that goes beyond just federal grants. So we're really thrilled about that. And I think, out of all of these accomplishments, probably the one that has been most meaningful to me and to, I think, our partners is just the relationships that we've built between our agencies. We didn't have regular touch points or a cadence of meetings. We met on an as needed basis. And over the last year, we've been meeting weekly, both internally between ourselves as well as with our TA. And that's really allowed us to dig a lot deeper into how do all of our programs work, or even more importantly, don't work very well for the folks that we serve, and where can we make improvements, where can we streamline things. So we have identified some goals like needing to streamline eligibility requirements across programs to make sure that we can better braid funding and support our local partners in applying for those funds. And also just having a greater integrated strategy across state agencies so that not all of the burden falls on a local nonprofit or a service provider to figure out how to maximize all these different sources of state resources. So I sort of look at this as just the launch pad, but we have definitely gotten a lot done this year and are getting ready to go into our budget and legislative session and have made some requests related to these programs. So we're fingers crossed going to be successful. Next slide. So a couple of the things, lessons learned for us, I shared about this a little bit, but regular interagency collaboration that it not only strengthens our partnerships, but really that regular cadence is where we get to dig deep We get to better understand each other's systems. I know a lot more about Medicaid and long-term support services and AAAs and disability services than I did a year ago. And as someone who's supposed to lead a statewide strategy on homelessness, that's really important. HSPA, I feel like is where we laid that framework and that groundwork to be able to do even more looking forward. And then this also really supported our governor's goals to ensure interagency collaboration and that we're providing a good customer service experience to our local partners who are doing the work, whether that's government or nonprofit. Some challenges. We all have a lot of things on our shoulders. So one of the challenges is we're a small state and therefore we have small teams. And a lot of us, this is just one of many priorities that we're working on and trying to move forward. And also a lot of the programs we are operating within have long-term timelines for implementation and approval processes. So one of the challenges we're working through now is my timeline for developing a permanent supportive housing priority for LIHTC is very different than the timeline for Medicaid expansion and how that works and who that has to go through, and is very different than our state budget process. So figuring out how to align a strategy over a multi-year period so we can sync up with all these different timelines is difficult. And I think we're going to have to continue navigating that. That's not a problem that's probably going to go away. So we're going to have to keep working on that and figuring out how can we come up with a multi-year strategy going forward that everyone can buy into and integrate into their individual plans, since we're not on the same timeline. And then our core team members. So probably we need to bring more of us in. So we, one thing I'm always thinking about is succession planning. We don't want the work to stop just because one of us might leave state government or things like that. And we have a really great group now, but we're starting to broaden our core team members to other people within our agencies to make sure we're building more relationships between different teams. So I'm bringing in folks from my non-homeless services team to work on our older adult grant. We have folks at Aging growing their team as part of the collaboration. So we started with a core group of 4 people, and now it's getting bigger and bigger, which has really helped streamline across all these different programs and is going to lay more of a foundation for the future to make sure that we don't lose our momentum and all the accomplishments that we've had so far. Next slide. And so looking forward, the next sort of phase for us is that statewide expansion of ACES. So that's going to require a lot of work. We're going to be moving from 4 jurisdictions out of 24 counties to broaden that hopefully statewide. That's going to require us to work with a lot of new partners that we haven't so far, and helping them learn how to participate in a Medicaid reimbursement model and learn a whole new lingo. So we're also looking at, who are the right partners to be in that work with us, and looking at our continuum of care network, looking at our health departments, looking at our aging agencies, our centers for independent living, and figuring out how at a local level we can partner them together a little bit better. A lot of our systems don't really collaborate very well or aren't networked the way we're starting to build a network at the state level. So one of the things we're going to be working on in the new year is bringing those local groups together and sort of mirroring the work we've been doing at a state level to increase engagement and increasing that integrated planning that we want to see and we think is really successful. And then the next thing is, as I shared, finalizing the design of this new PSH intervention and creating a clear framework for how we're going to match and braid, the tax credit projects that we fund with the support services providers we fund under Medicaid. And then also how are we bringing in other healthcare resources to that model? So over the next year, we're going to be working on things like, what should a program eligibility definition look like? And how can it not just serve, folks who are maybe meeting the HUD definition of homelessness, but also can serve folks who are in an institutional setting and need to exit back into community-based living. Something that can benefit all the different populations we work with across state government, not just one group in a silo. And then also identifying how Medicaid and Medicare can be leveraged in the long-term supportive services space, and or looking at how we can expand our older adult home law programs statewide. We'd like to get that into every jurisdiction in the state, not just the 8 counties out of 24 that we're planning to fund in this sort of 3-year pilot round. So we'll be working really hard. And I think I just want to share, thank you to all the states that have been part of this. Many of you we connected outside of these formal convenings, and we had some other successes too, like Massachusetts, for example, met with us to share about their data warehouse for COCs. And we used a lot of those learnings to guide our data warehouse for our state. So we had some other projects that sort of went beyond this that we took lessons learned from other states, and I don't think would have had that connection and that opportunity except for this particular collaborative. So we're really appreciative for everyone from other states that helped us ideate and come up with some solutions as well.
Thanks so much, Danielle and Maryland. And we're really excited to hear about your home modification work and look forward to understanding how ACL can help support that moving forward. And now we're going to move on to Massachusetts. So next slide, please. And Gordy?
Can you hear me? Can you all hear me?
Yeah, we can hear you. We can hear you.
Oh, okay, all right, great, thanks. Okay, so we'll start with accomplishments. First of all, my name is Gordy Calkins. I'm the Director of Individual Homelessness for the Executive Office of Housing and Livable Communities. So we are the housing entity. I believe we joined today on the call with
You made this the ASL interpreter. I can't hear you or understand you.
Oh, am I speaking too fast or?
You're a little bit garbled.
Let me switch my microphone, see if that helps.
Thank you.
Is this better?
Much better. Yeah.
Excellent. So sorry about that. I'll begin again. So my name is Gordy Calkins. I am the Director of Individual Homelessness for the Executive Office of Housing and Livable Communities. We're the housing agency in Massachusetts. And also on the call, I believe, is my colleague, Emily Cooper, who is our Mass Health and Elder Services guru for the Commonwealth. Mass Health is our Medicaid agency. So we'll start by looking at our accomplishments. We wanted to start just by understanding what it was that we had, and what was working and what was not. So I'm going to take the bullets a little bit out of order here. We did a subgroup of us focused on the housing inventory charts from the 11 COCs in Massachusetts. We are a little state. 11 COCs, while certainly nowhere near as many as California, is an inappropriately high number for the geographic area of Massachusetts. That said, we attempted to, well, we did. We dug into all of those housing inventory charts and mapped out permanent supportive housing inventory statewide. It turned out to be absurdly difficult because not all of our COCs had done a particularly inclusive, had not included all of the PSH within their geographies. So we ended up having to pull in data sets from lots of different places. I don't think we were unique in that, but it was what we expected to be low-hanging fruit turned out to be quite complex. We also, we did a bunch of interviews with permanent supportive housing service providers. We tried to understand what the service funding strategies they were using were and what the barriers to accessing services were for the providers. Funding for the services were. We did what we felt like was a pretty good cross section. We looked at small providers, big providers. We tried to have good geographic diversity. We looked at providers with different focuses, and pulled all of that work together, and then did some analysis of what strategies were pretty universally reported as effective and what was universally not reported or reported as not effective. And then we developed a work plan for spreading the news about what worked and for addressing those barriers. And then we also tried to develop a sustainable work plan for all of us, including our parent agencies. So it wasn't just the group. Our agencies took on bits of work that I'll get to in just a moment. Next slide. So with those interviews, hold on. I didn't switch my own slide in my notes here. So one of the things that we discovered was that service providers often misunderstood the eligibility and enrollment processes, primarily for our biggest sort of Medicaid-funded service provision is a program called CSPHI, and their lack of understanding left a lot of eligible people unenrolled. So a lot of potential federal funded services we just weren't being reimbursed for. And also a lot of time being spent on enrolling those that were ineligible. So a good example, CSPHI's eligibility was expanded a couple of years ago, but it was far from universally understood that there were quite a few more people that were eligible for it than what people thought. And part of that is just it's all complex. It's not just CSPHI, it's all of the different kinds of service provision resources, and it's hard for providers to get their heads around. We had a few other additional challenges. So when we're trying to build new permanent supportive housing, usually a developer with a provider, sometimes it's the same agency, comes to EOHLC and says, hey, we have this idea, we've got our eye on a piece of property. There's a whole procurement process. But they come in and that whole process is unruly, it's slow, it's cumbersome. We didn't need this process to know that was true. But this process brought even more kind of problems with that to our understanding. One of them is that the process doesn't consider long-term sustainability of supportive services at the time of figuring out whether or not the project is viable. So we think deeply about how to fund acquisition and rehab and ongoing building and unit operational costs. But at that moment of, hey, we're gonna put our shoulder behind this and support this effort, we have not yet really thought about sustainable services. That's kind of a problem. And then some of our supportive service streams remain unutilized in the way that we talked about just a moment ago for the CSPHI. Next slide. And then so our goals for 2025 and going forward, we're going to try to increase the utilization of Medicaid-funded tenancy supports, and including kind of all of the stuff. And so this is right. Many of these bullets are right from our work plan. Figuring out how to fill the gaps in our processes. Our processes are hard and cumbersome, and it's not easy, and and so how do we fill the gaps so that it's easier to understand? How do we talk consistently across state government about what the eligibility is and what those processes are? And then how do we support infrastructure for service providers? And so I'm going to skip a few bullets here and quickly move down to exploring a third-party administrator strategy to support service providers in the effort to enroll. We're actually talking with Arizona, I think, tomorrow. And because they've been doing some of this work and trying to get a sense of like, how do we start? What's the effort? What are the barriers? We're also looking this year at interagency processes for service funding and accountability, including the process map that we talked about wanting to do at the very beginning and haven't been able to get to. We're really looking at what is a sequence for when you're putting together PSH, what is a sequence for all of it that folds in the services when you're putting together your package and your program. And then the last bit is, nope, there's two last bits. We have I think we've talked a few times in the past about our bond bill. It's got a supportive services flex pool within it that is, as of yet, still wide open for our crafting. And so we're going to use these learnings to craft that pool in such a way that it fills actual gaps that aren't currently mostly around eligibility for people that aren't eligible for any other service. And then as far as sustainability of the effort, we're going to leverage some already existing groups to continue work on efforts on some of the thornier situations. Thank you.
Thanks so much, Gordy in Massachusetts. Now we're going to move on to our friends from Minnesota. So let's advance the slides. And Tom?
All right. Hi, folks. Can you hear me okay?
Yep.
All right. Fantastic. Let's see here. As we get started with the look back on 2024 accomplishments, what comes to mind for me in terms of our Housing and Services Partnership Accelerator experience is that it was a really timely opportunity for us because 2024 was kind of it kind of felt like an administratively transitional year where we had launched housing stabilization services in July of 2020. The program had really ramped up in the subsequent years. We served over 18,000 people in 2023, and we had over 500 providers who engaged in the service. But we were also in a space of really getting a lot of feedback, both internally as well as externally, that there were some significant opportunities for improvement in terms of HSS meeting its full potential. So this was a really great opportunity for us to kind of carry on with some of the conversations we were having around what needs to change, how can we help support this benefit getting to where we hope it can be. And so the first thing that I think we really accomplished this year was creating our Housing and Services Partnership team. We were able to bring together members from our aging, our disability, our healthcare administration, and our homelessness and housing spaces. We would meet monthly. It was a brand new meeting. It wasn't something that had existed prior to the Accelerator. And I think that we really have just started the journey of what we can be doing by bringing that group together regularly. We, at our December meeting, talked about how we'd like to see this group continue to meet in 2025. And we're going to use the first kind of 3 months of the year to identify how would we like our membership to expand and what are some of the deliverables that we think that specific group can focus on in the year ahead. So I'm just really excited that this new thing exists that I think will really continue to bring together folks from across those different areas. The next thing that was an accomplishment this year was really integrating the lessons that we learned through HSPA into statewide community engagement work that we did, legislative proposals that were developed, and a request for rate setting and service design assistance that'll inform the future direction of the benefit. I'll talk a little bit about that more later on in the presentation. And then we also used HSPA to get really clear on developing some priorities for ongoing enhancements across our benefit access, technical assistance, training, and benefit design. If you'd like to go to the next slide. All right, so one of the big pieces of feedback that we were getting in terms of our implementation of housing stabilization services is that a lot of the providers who typically engage in our homelessness and housing stability space were no longer really engaged in utilizing HSS as one of their kind of program areas. They had really stepped out after the initial launch in a pretty significant way. And we were really trying to figure out what are some of the things that we can do to help bring those subject matter experts back into our provider network for HSS. And something that we heard a lot about was that our 15-minute increment model with Minnesota was really challenging for those providers who otherwise don't administer kind of Medicaid funded benefits. So it's really helpful to hear from other states about either using a daily or a monthly rate. And so right now we're in the process of contracting with a vendor who will be doing a pretty comprehensive study and evaluation of HSS. Part of that's going to be including making a recommendation on what we can do in terms of our increment model. So we're really looking forward to that coming up in 2020-25. The other thing that was really helpful to hear, because I think it would have been easy for us to just narrow in on changing our increment, but to hear from other states who are saying that they also needed to provide ongoing training and technical assistance around not just service delivery, but also Medicaid administration. That was a really helpful piece of information for us. It broadened our perspective and it helped us bring to agency leadership the importance of building out that technical assistance and training support for our provider network. Some additional challenges that we're still facing within 2024, simplifying our eligibility determination process and the associated administrative work is a key to establishing a timely and responsive benefit. Outside of kind of the long-term strategic space, the biggest challenge that we've faced is that we were staffed to be able to process about 2,200 applications per month. And as the program has grown, we've landed in a space where we're receiving about 3,500 applications per month. So we've kind of seen this trajectory where we've gone from being able to process applications within 10 to 14 days, then it was 30 days, then it was 40 days, and now we're up to about 110 days. So that's really increased substantially. We've been able to initiate some overtime initiatives for our eligibility review specialists. We've also been able to elevate this as a priority with our agency. So we're able to get a commitment for some additional temporary staffing to help us reduce that application processing time. But I think that HSPA really helped us narrow in on the message that we think we've got a really well-designed service that can be provided when it can be accessed in a timely way. And we've really got an obligation for ourselves on the state side that we can process those applications in a timely way, make sure that people can get access to the services quickly. The other thing there I listed under challenges was that our HSS provider network benefits from consistent and ongoing technical assistance and training, both in regards to service delivery and Medicaid administration. And this is an area that needs additional support. One thing that's been, I think, in some ways really exciting, but also a challenge, is that we have seen a lot of new providers step into this work to step in to be housing stabilization services providers. And so it's really helped expanded the network of folks who are engaging in this work. The challenge of it is just like making sure that we can ensure that folks are getting high quality, reliable, and consistent services from the providers in our network. All right, you can go to the next slide. All right, continued sustainability for 2025 goals. Like I said, we want to reduce the barriers to timely eligibility determination. Something I want to just give a shout out for our technical assistant coaches is that they were really helpful for me in my role. I want to thank our state's Housing and Services Partnership Accelerator team. So I think I was about 6 months into this work when this got started. And so I was, like many other folks, just like kind of absorbing the flood of Medicaid administration, trying to learn as much as I could on this journey. And it was so helpful to have our TA coaches to give some guidance along the way. One of the things that they were really helpful with was identifying that, you know, your eligibility determination process and your housing focused person-centered plan are more administratively intensive than what we're seeing in other states. So that can be something that we can work on moving forward in the future. As I mentioned earlier, we're really hoping to be able to get approval from our legislature to be able to restructure our benefit increment and our rates to support increased utilization of HSS by homelessness and housing stability focused organizations. And then lastly, really want to continue to develop strategic partnerships across the aging, disability, and homelessness housing stability resource networks, so this can help increase access to HSS for eligible individuals, as well as increase the consistency, reliability, and quality of services provided by HSS. So when it comes to that partnership that we started this year, I really think that we're just starting to figure out, okay, if we can make some structural improvements to the benefit itself, what are the opportunities that then can get created in the aging space? So like listening earlier today when Arizona was talking about the work with the AAAs, it's pretty cool that still 12 months into this, folks are talking about the work that they're doing, and it's still energizing and it's still inspiring and it's still adding to the list of possible things that I hope we can explore in Minnesota in the future. And I think that's all I've got, Ryan.
Thanks so much, Tom in Minnesota. Really great to hear about all of your accomplishments. So now let's move on to the next slide, please, in our next team. And we have the District of Columbia. So Elizabeth?
Hi, thank you so much. Yeah, I'm happy to talk about DC's HSPA experience. I'm Elizabeth Garrison. I'm from the Healthcare Reform and Innovation Division of our state Medicaid program, the Department of Healthcare Finance. So I think that this has been a really great experience for us to be able to continue planning and deepening relationships. So our major accomplishments, I think the proudest we are is of our 1115 waiver submission and really moving forward in the direction of covering additional health-related social needs. And it was a tremendous opportunity to be able to connect via HIPAA to other states. And I think in particular, the Advancing Partnerships Conference was really helpful to be able to really see sort of where everyone was at from a state perspective in terms of the strategies that were being implemented, as well as, you know, specific to 1115, what were some of the new approaches that were being leveraged to deliver care. We were really able to take some time to deepen the coordination, understanding, and shared language between partners. I think this was particularly helpful for Medicaid as we are newer to the housing space, and we're still trying to learn and understand how funding and care delivery works in our partner organizations and think through how to best manage shared populations. To that effect, we were able to complete a crosswalk of some of our services that are delivering both care coordination and healthcare supports, as well as housing resources, and really think about where we have some gaps in care and how those could be addressed through 1115 and then through future coverage ideas, and are moving forward, you know, to really think about where there are opportunities to address care gaps and what can we do to increase capacity for supportive housing, care coordination, and care transitions. Next slide. In terms of lessons learned, I think we tried to take on everything at once, and we're finding that with the intersection of HSPA, with budget season, and with a lot of other things that are going on, including just the lift for moving the 1115 waiver forward, that we will need more time to continue to work on the HSPA goals. We will need additional partnership and engagement with our partners to think through how we will operationalize the 1115 strategies. But this was really helpful for getting us off the ground, as well as informing our technical assistance and community engagement strategies, which will continue a lot of the work. We are also, really interested to see where other states are going in terms of some of these newer services like the 6-month housing benefit and how we can overlay them in our system, and still trying to think through how some of the like payment and claiming strategies will work in our particular system. In terms of additional challenges, I think that I would flag that, you know, there's been a lot of moving parts over the last few months, and certainly, you know, DC is not the only location in our state that is impacted by, changes in economic forecasts. You know, certainly as we have transitioned away from some of the COVID assistance, we're still trying to figure out how we can continue some of the programs and resources that began when there were additional federal funds available to states for this intersection of homeless and housing services. And we're also, continuing to work with CMS to get some clarity about our specific care delivery approach for 1115. So we thought maybe we would have more of that accomplished sort of during the HSPA period, but we're continuing to work with our partners and are hoping to get our approvals in order in the new year, so that we can continue to move forward with operationalizing those. Next slide. And then, as I mentioned, we're really going to be focusing on how we will operationalize some of these key HRSN services for medical respite, 6-month housing supports, and for HRSN care coordination. We're looking at opportunities to partner to expand permanent housing resources through new federal opportunities, as well as to increase data sharing that is from HMIS and other homeless data sources with MMIS and Health Information Exchange. It's going to take some more time to figure out how we will map that, but we've begun to start talking with partners and start exploring where there might be opportunities to do that. And lastly, we will continue to engage our community partners. I was late for the call because I was leading another discussion with community partners around some of our behavioral health, short-term, post-transition housing resources. And so I'm hopeful that we will continue to be able to have those conversations about what care needs exist and how we can use the 1115 interventions to meet those, and that will enable us to be really successful and continue to figure out how to intersect health and homelessness and how to really meet some of the needs of our beneficiaries. And just thanks to our HSPA coaches for all the support. We really benefited from having the technical assistance around service array and around housing resources and HUD funding. So thanks again for all your support.
Great. Thanks so much, Elizabeth and DC. And you all have made a lot of progress, and excited to see more progress over the next year. And now we're going to move on to our friends from North Carolina. So next slide, please. And Josh.
I do want to apologize. We've had some, as you guys might have heard, we had this thing called Hurricane Helene that came through Western North Carolina on September 28th. So our state's been having a lot of different areas that we're working and pulling together to address that particular hurricane. There's a couple better words for that, but as far as what we've been able to do, 2024 has been a very, very good year for North Carolina for having multiple things that we have accomplished. With particularly with the Accelerator, one of the things that we were able to do across all of our different housing programs is to identify a lot of the different funding stream, the services, entrance criteria, try to figure out exactly what is significant and different about each of our housing programs. That way we can provide information to the people on the ground providing those services, and to make it as easy as access as we can for the individuals who need those services. So the reason why I'm bringing this up is because immediately once we hit Hurricane Helene, they started asking about housing resources. So the first thing I said is, hey, I'm part of this group and I have this Excel spreadsheet that literally has every housing service in North Carolina. You're welcome. So that communication infrastructure has been instrumental for North Carolina's housing services. It's made communication easier as far as between the healthy opportunities as well as the back at home disaster resorts for that Helene recovery. So all in all, the work that we've done here has brought North Carolina housing partners together to be able to, in this case, meet a natural disaster and feel competent that we know what we're doing with our housing resources. One of the other things that I'm very happy with the work that we've done with HSPA is because one of the things that I'm responsible for at North Carolina as the Olmsted Housing Director is I oversee the North Carolina Strategic Housing Plan that launched on July 1st of this year. One of the things that was called out as a request on that strategic housing plan was to develop a state level policy draft, something, pay no attention to the loud noises in the back, regarding permanent housing in North Carolina. So as of today, we do have a permanent supportive housing framework draft. We are going to continue to work with our different stakeholders to review, improve, mess with, and refine as we go along. And definitely like the work that we've done with the HSPA Accelerator has been very helpful for that. One major accomplishment from North Carolina as well, as I just got 2 pieces of news as of this week. One, we've been waiting for just a little bit for our 1115 waiver. We originally were approved and we had a continuing waiver that was sent to CMS. That was approved as of this week. Also, from the Olmsted team, which is what I'm a part of, we've been working through with the Department of Justice since 2012 on our Olmsted settlement. As of today, we had the judge sign off on I think it was the 6th modification. The reason why this is very, very significant is because during this modification and sign off from there, we were able to discharge 2 of the main areas and responsibilities from that Olmsted settlement, which was both our quality assurance area as well as diversion. So those are 2 huge accomplishments that I definitely think that the work that we've done through HSPA has been able to make possible. As far as lessons learned, one of the big things we definitely learned is that we need to communicate more, especially with our subject matter experts. For better or for worse, North Carolina was either lucky or unlucky that a lot of the individuals that were on our team had been with North Carolina for less than 6 months when we started this. So unfortunately, none of us can say we are new anymore, but we definitely have gone through the paces with one another and learned the different pieces and showed the importance of having regular communication and touch points with each other. We also have a much clearer picture now on how to leverage our programs and to develop swim lanes so we can figure out exactly who is going in which direction and where we can easily tap into different resources and different availability pieces. So that is also very, very cool. Challenges, I'm just going to throw it out there. We had a hurricane that we have not seen the likes of that hit Western North Carolina in September of this year. We are still working on assessing damage and just beginning the recovery efforts for all of that. However, I can say that the work that we've done through the Accelerator, through this piece from here, as well as the relationships we built through here in the different areas of housing, both with the Technical Assistance Collaborative, our work with HUD, and just different areas from there have allowed us to continue that effort and work towards recovery as far as from there. Another challenge we've been dealing with lawsuits and different pieces from there. So the pressures of that 1115 waiver expansion, this is normally where in our presentation piece, I would say, and here is my colleague, Maria Perez from the Medicaid agency, who basically handles all of this stuff. But unfortunately, she could not be here today. So you guys got me. Oh, well. Also, another challenge that we're looking at as far as coming up is we're going to have an administration change at the state level and at the national level come January. So that, again, is going to be change. And sometimes change is great and sometimes it's not. So how do we keep up with our continued stability? One of the very good things that we have, I just want to say, even if we have changes in administration, whichever, the good news is we have individuals and state offices and just different programs in place that we will continue the mission for serving individuals who need housing in North Carolina. I mean, a lot of the work that we have that we've started on the housing side was kickstarted by a visit we had from Richard Cho from back in September of 2023. I shamelessly throw this out every time I get a chance. I'm just going to throw that there. He did identify North Carolina as a unicorn regarding all of our different housing and managed care organizations and the way we braid and work together services and housing. So I think that's very cool. We're going to be continuing for sustainability to have our guidance document into a usable document that we're going to be moving through and moving to be published. We are going to continue the work through HSPA already through the strategic housing plan. We have an entire pillar dedicated to services that will be taking what HSPA has started and expanding it beyond our state offices to some of our managed care organizations in different areas. And we're going to continue to meet and identify goals and continue to press through different areas that we need to accomplish. And we very much appreciate all the technical assistance we've received from this work through this accelerator. And it's been awesome for the state of North Carolina. Thank you so much.
Thanks, Josh, and to the North Carolina team. And our thoughts are continue to be with you in your hurricane response. And so glad and grateful to hear that the HSPA work and the housing inventory has really helped accelerate in your response at the state level. So excited to continue to work together in future opportunities. And now to our last but not least team, we'll kick it over to our friends from Washington State. And next slide, please.
Thanks, Ryan. This is Matt Christie with the Washington State Healthcare Authority, our state's Medicaid agency. Happy to share on behalf of our core team across our housing agency, as well as long-term services and supports, and Medicaid, our core team. And we, just looking back at 2024, had a lot of lofty goals. I think some of my talking points kind of will hit on this, but we have a long history of working together in different capacities on different programs. So pulling together our core team, I think, was an easy task, but really identifying and moving forward on priorities. For the accelerator, even in the application, I think was quite a bit bigger of a challenge than we thought it would be, because we have so many things that are in the works. But I just wanted to highlight that we continue to strengthen our core team, working with our partner state agencies, as well as our support team. I think that's one thing that we, looking back, have a lot of support from our community with different stakeholders across, different provider types, managed care, housing authorities, and other community partners. And I think that engagement with broader community stakeholders has been a good accomplishment. We've been working with our coaches at TAC on conducting key informant interviews with those providers to really dig into a lot of the issues that we've known about and not necessarily had a lot of either bandwidth or guidance on how to address. And so the accelerator has certainly been helpful in figuring out kind of different approaches to navigate different strategies. So an example is just looking at how we've begun specific targeted trainings on incorporating home and community-based settings rules within housing in one of our state-funded initiatives that we pair with our Medicaid-funded supportive housing benefit. We've also just looked at different ways that we can align Medicaid services with coordinated entry and have begun partnering on a Medicaid performance improvement project. As well as just looking for ways to, strengthen those collaborative efforts with coordinated entry and our Medicaid, our providers operating Medicaid funded support services. And we've also, learned from a lot of you all on just different strategies and approaches. We've been participating in a few different work groups with different states around health-related social needs, and have been moving forward on our 2 housing benefits under the health-related social needs services framework, rent and temporary housing and housing transition navigation. And I think through the accelerator really narrowed in on 2 pretty solid approaches on how we want to implement those 2 benefits and create those partnerships. This also ties in, I guess, probably to the next slide. We've identified that pathway for, connecting short-term and long-term partnerships with our rental assistance and different state and federally funded resources. But if we go to the next slide, I can talk about how that's also one of our challenges. And I think that's, maybe it's a little out of order, but, really digging into what does that connection look like. So we have our short-term rental assistance in a few different forms. We have some state-funded programs that can pay for some similar things, but kind of what does that 6 months of, or up to 6 months of rental assistance look like? What does that connection point look like with other long-term resources? Do they target the same populations? And kind of do they prioritize, those that target population in the way that we can with Medicaid waiver dollars and things like that. So that, lesson learned there. We really need to work with the stakeholders that do that work. So we're looking, at partnering with public housing authorities and other players in the housing support world that haven't been historically doing Medicaid. And so earlier engagement, I think, with those stakeholders would really have benefited us quite a bit. That's not to say that we can't continue to build on where we've started, but I, would have always loved to start sooner. But we're also, looking at the existing infrastructure that we've built in Washington, and how to strengthen the connections between them. So we have provider networks, we have our managed care organizations, we have we're developing community care hubs under our waiver, and different sort of community-based care coordination efforts, and how to align everything and how to really continue to build on our housing continuum, or just support services continuum that really meet people where they're at in the community. And I think one of the other lessons learned that we wanted to highlight too is that just really strong alignment between state and federal policies and goals is really critical when it comes to moving the needle on the work that we're doing. Additional challenges, I had mentioned this at the beginning, but identifying cross-agency priorities is really hard. And then incorporating community feedback is even harder. And how do we, go the extra mile of, really intentionally engaging with the people who are doing the work, the people who are receiving the services, and have that inform our approach moving forward. And I think that's just, us recognizing that we have built quite a lot since, we've started this work. Our waiver funded support services started back in 2018 for supportive housing, but we still have a long way to go, especially now that we're bringing in additional resources. Next slide, please. And as for our continued sustainability goals in 2025, we're aiming to launch our health-related social needs funded rental assistance and create those pathways towards longer-term resources and subsidies, whether that's with public housing authorities, federally and locally funded vouchers. We have a few partnerships with the Department of Commerce to leverage both Medicaid funded services, rental assistance, and pair that with our state-funded rental assistance and state-funded dollars for capital, really investing in permanent supportive housing, and creating those intentional wraparound resources for people who are eligible for that housing. I think we've built stronger connections over the course of this past year, engaging with our managed care organizations, even though they're not necessarily directly providing the housing support services at this time, but figuring out ways to create better engagement and partnerships with them and other community members. Again, I mentioned those community hubs. We have accountable communities of health in Washington that are really interested and invested in this work. And so kind of bringing them into the fold, I think, is something that we'll see over the course of 2025 in ways that we haven't in the past. And then I think we just really, we're really dedicated to this concept of a continuum of housing services and supports that'll, meet someone where they're at, kind of regardless of the funding source, the eligibility criteria for that funding source, and really just figure out ways to de-silo and connect our systems. But I think that's probably it. I don't know. I know my colleague Melody is on the line, and I just want to make sure that if there was anything that I missed, if she had anything to add.
Matt, you did great. And, I think one of the other lessons learned, and challenges that Washington experienced, and sort of a lesson for the other states, is that, Washington has been operating our supportive housing, supported employment benefits under our 1115 since 2018, but it is a finite amount. And so in 2024, Washington had to pause the enrollment, and that actually really caused a stir. And so we're sort of a victim of our own success, in that so many individuals and communities are really wanting to leverage this benefit, but it's also that sort of Sudoku puzzle with this is not an entitlement, and so how to balance the caps that we have in enrollment, the utilization with the resources, and so to the healthcare authorities, credit and the partners with DSHS that we were able to move out of that pause in enrollment. But I think it's really a lesson to share with all of the other states on be leery of your own success in a way of what those caps look like, and how to move forward and how to disseminate that information to communities. Because I think that's where that key, as Matt was talking about with the stakeholder involvement, that's really key to be able to share and message that information out, that this is not an entitlement.
Yeah, thank you, Melody, for highlighting that. Definitely a huge, I think, lesson learned in just communication, and a reminder that, we started this work years ago, and there's so much, new staff, there's turnover, new players coming into this space, and we have to continue to reiterate what the goals are, how to get involved, and what the limitations are to set everybody up for the best success possible, and have kind of, as best we can, everybody be on the same page about what we're able to do with these services.
Thank you, Matt and Melody and the Washington team. Washington is always at the top of the pack, leading the way for all of us. And I think we've been really grateful to learn from the incredible work that you're doing. And I know that your team also has been really supportive of many of the other teams participating in the Accelerator. So next slide. So I think we're going to be able to end a little bit early, but we have some key information and a few more thank yous we want to share out before we let everyone go. I want to first thank everyone for doing phenomenal with time. You all really stayed tight in your presentations. We want to thank you because the federal partners and the technical assistance team have enjoyed learning from your teams and working with each and every one of you throughout this experience. We thank you for the continued feedback and input so we can continue to advance efforts to create cross-sector sustainable partnerships in a substantial and effective way. And I just want to say, I am in true awe of what each of your teams have been able to accomplish in just this 12-month period. I'm also in awe of all of our TA providers and federal partners who have come along with us in this journey. This started just taking a step back. I started with ACL and federal service in September of 2023, and we had a germ of an idea for an accelerator. And from there, we're able to launch this, plan it, and execute it with you all to really create a lot of great systems level change within your states and provide a roadmap for other states to really think about how they can leverage these opportunities to transform and impact lives. So it has just been an incredible experience. Next slide, please. So we know that all of the work that is being done by your teams and within your states aren't just your state team leads. So we wanted to really thank every one of your teammates from all of the sectors that have been represented during the Accelerator experience. And from all of the state agencies and all the community-based organizations, we hope you will continue to nurture those partnerships while building additional partnerships that can reinforce the work you're doing every day for the people you're serving in your state. So first, we want to thank Arizona, California, the District of Columbia, and Hawaii. And then next slide. We want to thank our teams from Massachusetts, Maryland, Minnesota, North Carolina, and Washington State. And the time you have spent developing, planning, and working towards enhanced implementation of housing-related supports and services being offered through your 1115 demonstrations or 1915 state plan amendments. We hope you'll continue on the discussions on how to streamline services and include other states and local partners in providing these services and supports. And I think more than anything, we've learned that strong cross-sector partnerships are critical to helping individuals at risk of or experiencing homelessness, regardless of age or disability, find and access the housing and wraparound supports needed to maintain independence in the community and thrive. Next slide. We also want to send a special thank you to all of our coaches throughout 2024. We know that their one-on-one work with your state teams have helped you all and really helped you focus on your efforts of implementation. And so thank you, Ayana, Dawn, Janice, Jim, Jordan, Kathy, Layla, Laura, Lisa, Liz, Lynn, Matt, Nicole, Patty, Robin, Sarah, and Spencer. And, thank you to TAC to really helping to work with the state coaches and provide a really incredible experience. Next slide. And we want to thank all of our federal partners who have made this work across agencies. As I mentioned before, this started from a seed of an idea, and it really was our federal partners raiding their couch cushions to really figure out what resources we had in order to create this experience and ensure that you all have the technical assistance and the resources that you need in your implementation. So really grateful to HUD and SAMHSA who were able to help support the Accelerator in providing resources for the convening and the needs assessment and the coaching, in addition to the resources from HHS. And then next slide. And now we just want to give you all a chance to do a special shout out. So please feel free to drop it in the chat. And also, I want to apologize because we did set the meeting up a little bit differently. So folks were added as panelists or attendees, but we want to make sure everyone has a chance to chime in here as well. So we've promoted folks to panelists if you wanted to accept and come off mute. And you can also raise your hand and request to speak if you're still in as an attendee, and we can unmute you. So you can either drop your shout out in the chat or raise your hand to share it with the group. But maybe you want to highlight one of your state team members who has been an active participant on your team, or maybe you want to give a shout out to another state's team member you've learned from and worked with and connected with. I know we heard some of those shout outs earlier. Or if there's been a specific federal team member who supported you through your efforts throughout the 12-month, or if you want to give your TA coach a special shout out for all the dedication and work that they've done. So feel free to drop that in the chat or come off mute, come on camera. Also my federal partners too, while I often get to be the face of it, of the work that we're doing, it is a team effort across all of our federal partners and TA providers. So I want to give anyone and everyone the opportunity to just give a shout out. And so I'll just read some from the chat as folks are, if anyone.
I had my screen moved, so I couldn't get to the mute button or the camera button, so I was lost. I wanted to say thank you, Emily, Jim, Robin. You are amazing, and the things that you do with us and for us, I can't thank you enough. I wanted to shout out to our team because It's been such a pleasure working with them in this space and being able to dedicate time to this issue and not all of the other issues that have to be done, and just everybody here to have a community of practice where it's not just you and your team facing this problem and knowing that there's everyone else is out there and trying to solve for it, and the support has just been incredible. So thank you very much, and thanks to those of you who got the change out of the couch cushions to help us out with this, and Ryan for leading us forward.
Thanks so
You.
much, Deborah. And Sonia says a big shout out to Janice Miller and Lauren Conrad from TAC, who've been working with Maryland. And Melody wants to thank all the partners, especially SAMHSA, for the convening, which was phenomenal. Tom wants to thank the Minnesota team and his coaches. And Azusa wanted to thank Hawaii's coaches, Lisa and Kathy. Emily wants to thank Robin and Jim. I see some thank yous to me as well. So, I appreciate that gratitude. And John also shouting out Lisa and Kathy. And Detra also shouting out to Robin and Jim and the North Carolina team. Well, thank you all. Unless anyone else has any other shout outs, then we can move on to the next slide. Okay. So we still need your help. There are a few things that we're going to be sending some requests to your teams. So first of all, we are working on several technical briefs that will be referencing your accomplishments that we really want to lift up to other states who are seeking to implement these cross-sector partnerships. So we're going to be sending you excerpts from these briefs to get approval from your state leadership and ensure that we have accurate information. And I'll just say that we are really motivated to get these briefs out and published in early January. So we appreciate if everyone can expedite those reviews so we can get those briefs out. Second, we'll be compiling a public-facing accomplishment summary report for each of your states, which we hope to publish on the Housing and Services Resource Center website. This summary will be available to states to share with, also will be available to your states to share with your state legislatures and leadership for continuing expansion efforts in the field. And thank you in advance for your assistance in these reporting efforts. And we do want to hear from you too. So if your state lead hasn't already filled out our closeout survey for your state, please remind them to do so. In addition, if your state hasn't scheduled your closeout interview, please reach out to Kelly Atkinson on the New Additions team for a date and time that will work for your team. And the closeout survey is really important because we're using that to help inform the next phase of ongoing support. Finally, if you have any additional thoughts or reflections or recommendations, please feel free to also send those to our HSRC inbox at hsrc@acl.hhs.gov. And as noted in the closeout survey that we sent to the state team leads to complete, discussions are underway to determine what ongoing technical assistance can be made available to the first cohort. Sometimes through joint activities with our second cohort that we will be making the selections in early January. The possible options for continued support include limited one-on-one coaching, peer learning sessions, community of practice that we'll be launching that will include local engagement in addition to the state level engagements, quarterly webinars, federal office hours, and in-person and another in-person convening. So once we collect all of your responses, we're going to look at our efforts and budgets to really finalize what will be available. And then we'll reach out to your state team leads about the ongoing opportunity. So please fill out those surveys. And we have a question from Melody in the platform to access the online TA community. That will still be available and up for you all to use. So that will not close out. Which we're really excited about that. And next slide, please. And finally, we'll be hosting our final lessons learned webinar for the 2024 cohort, which will be on January 16th at 3 p.m. Eastern. And we're still finalizing our agenda, but we encourage you to register for the webinar and share with your stakeholders. And we will be reaching out to states to help present in that webinar. We hope that those states who will be selected will be able to help amplify all the great work that you're doing. And the next slide. So, as always, you can find a wealth of resources on partnerships in housing, health, and social care, lessons learned, and best practices, and more through the Housing and Services Resource Center website. So just use the QR code to navigate there, or you can go to acl.gov/housing and services. Next slide. As I mentioned, the TA community is going to remain open, and it will also expand to include the new cohort, so you'll be able to engage with them. And then last slide, please. And I want to give a final thank you to our teams at New Edition, US Aging, TAC, and CSH for their collaboration on this project. It's been wonderful and has been a year of exciting innovation and peer-to-peer engagement, and we can't wait to see what you all will do in the next year and look forward to continuing to work with you all. And with that, we get to end a little bit early, which is always phenomenal. So I hope everyone has a great rest of your day and week. I hope that everyone is able to take some time during the holidays to re-energize, refresh, and come back for the new year to continue to tackle these really tough and hard issues and advocate for all the people that we serve. So happy holidays, everyone, and hope everyone gets some rest.